I'm Dr. Logan Ponce, physical therapist here at Elevate Sports Performance and Healthcare in Las Vegas, and today we have another episode of Doc Talks, where the subject today is going to be the effects of prolonged sitting. Now, this is kind of a subset from last week's Doc Talk, which was, does your workstation promote movement? Movement is key, movement is crucial, and today I'm going to go over just a couple things on what happens to the body if we're not moving, if you're stationary, and letting things happen, okay? In less than ideal postures. So we just know that in general, all day long, we're fighting against gravity, right? That compressive force downward. And the body's built to withstand that force and disperse it evenly. So what can happen though is that we can have undue stressors if we don't have good posture that can influence and then therefore lead to injury. So one thing that we know, over time, those postural muscles can tend to fatigue and tired if we're working too much in any one position, okay? So your normal standard sitting posture should look like this, nice and stacked, nice and vertical, a little lumbar support, a little bit of curvature here, the lumbar, you should have some back rest, you should have your feet planted. We'll talk more specifics of ergonomics in a second, but what can happen over time is that we end up going from this nice upright position to things a little bit more lax, a little bit more forward, a little bit more back. This is going to put a lot of stress on the body, okay? We know that the body is meant to try and conserve as much energy as possible, so it's only going to do as much as it's needed to get the job done. So usually we're more comfortable being in the slump posture, just letting most of our muscles just relax and let the chair or whereas our ligaments just take over and just hold our posture up. So we want to try to avoid that as best we can. We also know that sitting for too long, that's not going to be good for circulation. We need oxygen. The body needs oxygen and all the other healing factors, repair factors that go along with it, hormonal things, et cetera, et cetera. That needs to go through the body always. So if we're just sitting right here, we're not promoting energy. We're not promoting something called a muscle pump, which is pretty much like pushing toothpaste out of a tube. Anytime our muscles contract, it's gonna push any interstitial fluid out of the area, therefore promoting movement, circulation, okay? So circulation is key for oxygen, body needs oxygen. Also, you can get, as the body, as gravity tends to bring and push everything downward, we need that stuff to return. So if we don't have that, you can get pooling in the legs, you can get poor circulation, you can get swelling in the foot and ankles, that's a common thing. Also, we know that the veins in the legs have valves that prevent backflow of the blood. So if we're not allowing good circulation to occur, sometimes those valves can be damaged, therefore causing backflow and something we commonly known as varicose veins, okay? So we don't want that to, again, we want to promote motion, we want to promote movement and circulation. And finally, making sure you have a good footrest, all right? Or that your feet are planted firmly on something so that you don't have excessive compression on the back of the thighs from the chair. Big arteries and veins that come through here. So if you're cutting off that circulation, that's again going to be detrimental to the circulation in the legs, which, as we just discussed, can provide all kinds of issues. Also, joint hydration. The joints have two slippery surfaces that move together, glide and slide. If you're not moving, the two ends, the slippery surfaces can dry up, therefore causing stiffness, causing a lack of easy movement. You'll feel like that joint feels stuck, like maybe there's a pinching sensation. You'll get loss of motion. So movement is very important for just all your joints, but specifically in the spine is where we see a lot of those issues, where if you're not pushing through your full end ranges, if we're just focusing on one end range, that can be detrimental, loss of motion, pain, et cetera, et cetera. So we don't want that. Now, going back to the posture over time, one thing that we see too, instead of being nice and upright, we can tend to slump back, and we call this a posterior pelvic tilt, where your pelvis tends to roll backwards just like so. The issue with that is normally we should be sitting and weight bearing on our ischial tuberosities, our sit bones as we like to call it. When we tend to slump though, our hips roll back, and then we tend to put all of our pressure here on our tailbone. And as you can see, these nerve roots that come out of here too. These nerve roots join together, form a large nerve called the sciatic nerve. Maybe you've heard of it. Runs down the back of the thigh. Long-term compression of this can aggravate those symptoms, causing sharp shooting pains down the leg, sciatica symptoms, as we can call it. And again, you're gonna have some numbness, tingling in the back of the hips, all kinds of issues going on there. So we want to avoid excessive weight bearing on the tailbone, making sure you have good enough backrest and that it's actually touching the back, so that instead of reaching for it like this, putting pressure on the tailbone, you're sitting right there on those sit bones, those big bony parts. If you reach under, you can feel them. Also, when we're sitting in this slump position, we're stretching the entire backside, okay? The entire line, the entire chain from the tailbone all the way up to the skull here, okay? It's all one big long mohawk. So ligaments, fascia, your postural muscles, all of those are put on stretch over time, and that's gonna do a lot of negative things to the body. One thing specifically for muscles that get stretched long term, a protective mechanism that they tend to do is they'll spasm. So instead of long-term stretch, instead of tearing, it's gonna lock up, therefore shutting off the circulation, maybe pinching on some nerves, causing hypersensitivity, and then you'll feel a nice ball inside your muscles. We like to call that trigger point, a knot, more commonly known as. So you can get those all up and down the chain, and I'm sure we've all experienced those at least once in our lives, and not a fun thing to deal with. So avoiding those muscle spasms due to prolonged stretch is important. Next, specifically in the lumbar, we see this a lot. When we're sitting, slumping, if we put excessive flexion on the spine, if you can see here, whenever we go to bend forward excessively, as you can see, it puts a lot of compression on the front of the spine and it pushes everything out the back. And that's where the nerve roots come out, all right, of the spinal cord. So each vertebrae has a space that nerves can come out of. If the disc pushes into that nerve root, that's again gonna cause a lot of irritation going down the pathway of the leg, and you can feel symptoms down the leg, numbness, tingling, sharp shooting pain, all kinds of number of strange feelings that's nerve based. So want to try to avoid disc related issues. That's why normally when we try to treat a discogenic issue, we tend to work more in an extension based movement, basically going the exact opposite direction of what's pushing those discs out in the first place. Something to consider. Also working our way up the chain. To counterbalance, if we slump like so, or if we let our pelvis relax, that's shifting all of our center of gravity backwards. So to prevent us from continuously going back, we need to counterbalance ourselves. How do we do that? Normally jut our heads forward, okay? Just so we maintain neutral, okay? So we stay balanced, we stay upright. But what that's gonna do, add a lot of excessive flexion here in the thoracic spine, and then we're also going to compress a lot here at the occipital region, okay? Where the junction of the upper neck meets the bottom of the skull. We'll go into that in a second, but going back to the thoracic area, this is where we have a lot of muscles cross from the shoulders up to the neck and vice versa. So a lot of muscles cross that neck-shoulder junction. We need to make sure, again, that we talked about earlier, that long-term stretching, this is where we get a lot of issues, a lot of long-term pain. These muscles that should be nice and strong and keeping us upright can tend to be overstretched, causing pain spasms, causing excessive tension throughout the area. You'll feel tugging in the skull, could cause headaches, things of that nature. So you want to try and avoid that as best we can. And then going to the head, all right, the suboccipital area, okay? We want to be nice and upright, because if we're going forward like so, that's going to compress and pinch right there at the, again, top of the neck, bottom of the skull, the occipital region. There's a lot of muscles, there's a lot of veins and blood vessels and nerves that go through that space. If those get compressed, again, that's going to cause a lot of issues, headaches, blurred vision, going to help with, prevent cognition effects. So you just want to avoid those long-term compressive, tension-based postures as best you can, okay? Another thing too, eye strain is a big thing. Over time, we just get tired, so we tend to squint and look forward, okay? Again, all reasons for you to break things up. Take rest breaks in between, okay? But finally, just being static, being in a position, posture for so long, you have a decreased energy expenditure, so you're not burning any calories. If weight loss is something that you're cognizant of, that you want to, one of your goals, just your fitness goals, you have to get up and move, all right? Because you're not burning anything, you're not burning lunch, you're not burning dinner. So taking those small rest breaks, go get a drink of water, stand up, go to the bathroom, or just take a small walk, maybe 45 minutes between working sessions is gonna be a huge improvement for you. You're also not stressing the cardiovascular system by staying static. So we want good, strong heart and lungs. You have to stress them somewhat every once in a while. So being stationary, not gonna help with that. And then also our cortisone stress levels, energy, activity, movement, that helps burn off some of those and brings down that cortisol hormonal level, which can add a lot to irritation, again, with cognitive deficits. So we wanna have low cortisol levels. Activity helps with that. So going back to it all, we want to take breaks, all right? We want to promote movement. You don't want to be in any one position for too long, all right? That's going to cause all kinds of negative issues that we don't want. So to review the proper posture, you should be nice and upright, head over shoulders over pelvis. You should have a good footrest, all right? So there's not compression from the chair or the back of the thighs, all right? You should be able to have a backrest so that you can comfortably be upright. And if you get tired, that's fine. You can go ahead and lean back, but you maintain a good neutral spine versus allowing your pelvis to roll back, allowing all these extra tensions and stressors to occur, and the compensatory movements that happen with that. Armrests, make sure you have good armrests here by your sides so that you're not reaching forward, again, pulling on all these neck shoulder muscles, and then having a good screen height so that, again, you're not promoting that forward head posture or too far up or too far down, okay? So again, movement is key. The body's meant to move, but we live in a day and age now where a lot of us are working from home, or at least we're very much stationary these days. So finding ways to manage that, to break it up, so that you stay moving, stay active, stay loose is gonna be very, very important for you, okay? To stay pain-free. So that's all I have for you today, all right? Again, just keep it moving, all right? That's the secret, not much of a secret. So if you wanna discuss any of this further, if you do have any pain or any issues, any symptoms related to work or sitting, or you just wanna get back to pain-free activity, give us a call, 702-558-2151 at Elevate, and we'll see you next time.